well is it shows a different amount of waves of fluid, because that's what you're looking for. So somewhat of a subjective test, but it's quick, and they use it again, like we talked about yesterday, for quick, we just did some stuff, you got an articular cartilage, or ACL or whatever, we just did some exercise, let's just quick get you back on the table and make sure we didn't overdo it, but the tissue responds. So it's nice and easy rather than sitting there without the magic measurement, so it's really quick. So basically what it is you're staring at the anterior medial kind of area right here in the knee, kind of this little divot as I call it, underneath the VMO. And so it's an upstroke, 3 upstrokes on the medial side. And so it's actually a 4-degree system. There's 0, 1, 0 trace, 1, 2, and 3. Is that 5? So 0 trace, I'm sorry, 2 and 3. And so what you're looking at with if you feel kind of that fluid feeling, I think everybody's kind of had a chance to feel that with their knees. If with the upstroke, I can't even push fluid, I don't get that divot, I don't see that, it's bulgy here. And with that push, it doesn't do anything, it stays. That's your high level, that's your high end, your 3+. Okay, if I'm able to push it out, but then upon my release, it fills back in, that's your 2. Okay, and then the other ones would be, it stays away, but on the 2 downstrokes, as I'm looking here, I wish somebody has swollen knee, and again, this is where the videos are nice, you'll see this fill back in, you'll see a wave of fluid. That, for your trace and your 1+, is dictated by how large the bulge of fluid comes back. If it's a small little wave of fluid that comes back in there, it's barely detectable, that's your trace. And if it's kind of a larger, that's a 1+.
And this is edema, not effusion, so not swelling in the knee joint or joint capsule, it's outside the joint.
I don't know if they've been...
I think it's infusion.
Infusion?
Yeah.
So it's actually like...
I would say it's outside because you're pushing it outside the joint. So edema. I'm not sure if they differentiate between the 2.
Edema